Awesome pleasure to have DEEPA SHREE doctor with us. She is the head of the Department of Radiology in Dr. Rela Institute and Medical Center. She's a motivational speaker, Zumba trainer, and one of the winners of Iconic Women Award. She's also an author. Her video to motivate doctors became viral. Wanted to mention that. Thank you. So my next question to DEEPA. See, I can understand what kind of commitment and involvement when it comes for a profession like being a doctor. So what I know as a doctor is the one who treats the patients. But what I see in you is totally different. You are also a fitness enthusiast. You are very much motivated also. So what people lack nowadays is the motivation. Whomever we come across, they say, I'm not even motivated to do anything for myself. So your guidance on that as a doctor and as a fitness enthusiast. So what is your guidance on that? Please throw some light, DEEPA.
Yeah. No, actually, see, first of all, I would like to start off by saying we never consider, we don't need any motivation to brush our teeth, isn't it? So because we just get up in the morning, we just go in and then we brush our teeth. It's only because it has become a habit for us. And our parents have taught us that first thing in the morning you need to do is to just go in and brush your teeth. Whereas when it comes to exercise or when it comes to fitness, it is some kind of a conditioning in our minds that it is an extra effort that you need to put into exercise. Exercise word itself has got the, something like, it's something which is, associated with the pain. So I think it's because of the conditioning, a pattern is set in our minds that you need to put in an effort. So you need some motivation. Whenever there is an effort involved, you just need to put in some motivation, and that's how it's been. So what I actually feel is, in order to be motivated, we should not consider exercise or any fitness activity for that matter as an effort, as an effort. If it is an effortless thing, you can easily go in and then you can do it. And most important thing is to schedule your pattern. So first of all, I tell my, everybody who comes across me, they ask me, what do you do? First thing in the morning, I wake up in the morning at 5 a.m. And then how do you kind of keep yourself motivated to wake up in the morning? I just tell them, even if you don't want to do anything, just wake up and put your shoes on. That itself is a motivator to just get you out of the house. So first put your tracks on, put your shoes on. So maybe that will motivate you to get out of the house. So we need to make it a habit and do something for 21 days that will become a habit. And surround yourself with people, like-minded people. I mean, I have a fitness buddy. You all know Deepti, and she's been my buddy throughout my fitness journey. So I think it's very, very important that you have somebody, a companion, who motivates you on the days that you lack motivation. So these are the two important things that I would say. Make it a habit and find yourself a fitness buddy, and that's it. It's just a piece of cake for you all.
Okay, that's wonderful. That's wonderful. So people have to stay motivated by being around with the people who are already motivated and who support you, and also schedule your day accordingly, right?
Yeah, so, and don't consider it as an effort. Don't consider it as an effort, and just just decondition your minds thinking that exercise is an effort.
Yeah, correct. Like how we brush our teeth, how we take bath every day. It has to be that kind of a question. Next to DEEPA, our doctor. See, everyone wants to stay fit. Everyone wants to eat healthy. Everyone wants to lead a healthy lifestyle. So if you see all this, these are all only wants. It stays as wants. But what is happening is just the opposite. So how to make this wants as a desire and then make them achieve? What do you think is the key for it?
The key is stop feeling guilty. I think all of us, in fact, most of the women, what we feel is we don't prioritize ourselves. I know we don't keep ourselves first. We always consider, others, our husband, children, in-laws, or whoever it is. We consider our work as a priority. Everybody else is a priority except you yourself. So what happens in that case is we all have got a lot of desires as well. I mean, you asked me wants to desires. I would rather say yes, we all have desires, but we don't manifest our desires. It never becomes a reality. It just remains as a desire unless you put yourself first. For example, if I take my own mom, she kind of gives a bowl of fruits every day, fresh fruits, and then she gives it to me saying that it's good for health. Everybody knows that eating a bowl of fruits is good for you. But then she hardly, eats a bowl of fruits herself. she considers me as a priority, and she never considers or she never puts herself first. So that's the first thing. Put yourself first if you want to achieve something. We don't have to feel guilty about a lot of things. And the other perspective, generally in our culture, is going to gym or going out of the house and working out, especially women. When they go out and work, they say, okay, doing housework is enough. Doing some kitchen work is more than enough. Get your kids ready for school. That's more than enough. That's also housework. That's also keeping you fit. Why do you need to go out and work, in the gym or, any center for that matter, to keep yourself fit? So sometimes there is a guilt. Oh, if I go out in the morning, if I leave my house and if I go out in the morning, what do people think about me? What do my in-laws think about me? So this is the feeling of guilt, thinking what others might think about you. All these things, they need to be erased, and put yourself first if you want to manifest something.
Okay. Yeah. That's a good different perspective you have shown, because I have seen this, thinking that what they will think.
Absolutely.
That is the problem. Yeah. They wouldn't have actually said anything. Husband or anybody at home, they wouldn't have said anything. But still thinking that they might feel, most of the women end up doing nothing. Correct.
Exactly. These are all the self-created thoughts, I would say. Nobody would say anything, but we create those thoughts ourselves. And I think we just need to get rid of those thoughts.
That's wonderful. That's a good takeaway for the day. That's good. Don't feel guilty. Okay. Spending time for yourself is not a big mistake. That is the right thing to do. That's good. Thank you. Thank you so much for that. My next question would be to DEEPA. Okay. Yeah. So, as a doctor, I wanted to take that as a first place. As a doctor, where do you stay? Where do you see us in the future, post this pandemic, post this corona? Maybe after a month, after 2 months, where do you see us? Which is such to be the top priority for us on the safety precaution, to stay away from falling for these kind of viruses. What safety precautions as a woman we have to take? I know it could be generic, but because the topic is on women, I'm more centric on that.
Okay. So with regards to your first part of the question, where are we heading? Where do we see ourselves after this pandemic? I would say we are heading towards a healthier world, undoubtedly. I mean, despite, whatever is happening right now, despite the current COVID crisis, it is teaching us a lot of good things. I mean, I think it's COVID is definitely all about the attitude. We need to look for the best things that this is teaching us. I mean, it is quite unfortunate that people are dying, but the mortality is very, very low, as we all know. And the best thing is the hygienic practices that this COVID has taught. We cannot forget about that. There are a lot of diseases, in fact, communicable diseases or the infectious diseases, which are spread because of unsafe hygiene. We are not hygienic enough, and because of that, there's so many things. Cholera, typhoid, you take it, there are so many other diseases, unnamed diseases. I mean, they're not as popular as COVID, unfortunately, probably because Facebook didn't exist during cholera time, probably because WhatsApp didn't exist during cholera times. COVID, it's kind of spreading rapidly, and that's the reason why this is very, very popular, because the social media has made it very popular. But one thing to learn is we are heading towards a healthier nation, because we all don't cough and sneeze on each other's faces anymore. We all wash our hands 100 times, and which we never did before. So that is the first part of the question. And with regards to the second part, in terms of the safety precautions, I mean, I would just say one thing, whether it is men or women, I think we just need to be responsible. I mean, there are a lot of things we are already following anyway with regards to COVID. But as a matter of fact, for any infection for that matter, we just need to be responsible, and we just need to be sensible. And we all know what to do, what not to do. It's just that we just don't follow them because, we are just irresponsible. So just be responsible for yourself and just be responsible for the society. No virus will touch us.
Okay. That's good. So good thing which has happened in the bad time is people have become more conscious on their health. So they definitely are more, tidy people now.
Yeah, definitely. Yeah. Definitely.
That's definitely, yes. Yeah. So good. It is giving us some kind of relief, we are all safe.
Yeah. Yeah. One thing I really wanted to say, if time allows, is to tell people who are actually watching this now or even later, to say not to worry about the number of positive cases that we are seeing right now. I mean, everybody gets worried about the positive cases. I mean, 85% of the patients who are COVID affected, they have mild symptoms, which means they just have like a little bit of sore throat or fever and they just come out of it. And only 10% of the people have got moderate symptoms, which means they need some kind of an oxygen support. And only 5% of the patients are critically ill. And these 5% of the patients are people who are obese. So first thing to remember, obesity is not good. And that is even all the more reason as to why fitness is important. So obesity, people who are obese is one of the biggest risk factors for COVID. The second thing is, all the other risk factors everybody knows, cancer, diabetes, kidney problems and everything else. And only 5% of the people fall into that category. There are a few exceptions as well. Unfortunately, few people are succumbing to the disease, but it's not a bad one. So please do not panic just looking at the number of positive cases every day. It is going to get better.
Thank you. Thank you so much for that added input, because, being a doctor who were treating all the COVID patients, to hear from you, it gives a kind of relief for us. So we don't panic. Okay, girls?
Yeah.
Okay. Next question would be for one of my friend have asked, what can make a person physically and mentally fit? Like a Tirukural she has asked. Deepa, it's for you. You didn't get it? Okay.
Yeah. Sorry. What was the question? Sorry.
What can make a person physically and mentally fit?
I think, I suppose Chandrika has already answered, this question partly. I mean, I don't think.
Add on to it, yeah.
Yeah. I mean, I think it's physically and mentally fit. It's mostly, it's a chicken. They both complement each other, I would say. It's a synergistic. If you're physically fit, you can be mentally fit. And if you're mentally fit, you can be physically fit. So as she said, there are a lot of things. If you want to be physically fit, we all know what we need to do. It's a lifestyle modification is the most important thing. So it's a physical exercise. It's very, very important that we do the exercise. As a doctor, I would say why we need to exercise. It's because it generates these feel-good hormones. We have serotonin, dopamine, which are actually secreted in the brain. And this actually gives you that feel-good effect. And because of the feel-good effect, it becomes an addiction. So once you exercise, you see the results, and because of the results, it becomes an addiction. In fact, the pain of not doing an exercise is more than the pain of doing it, isn't it? Once you reach a particular stage wherein you really can't refrain yourself from any physical activity. So the key is a kickstart. Somebody needs to kickstart or a self-start. You need to start off with a physical activity. And that is the key to staying physically fit. And this, in turn, leads to mental fitness as well. Because if you're physically fit, as I said, because of the hormonal changes in the brain, because of the chemical changes in the body, you can be mentally fit as well. And as Chandrika said, I'm a very big follower of law of attraction as well. I strongly believe in meditation. I strongly believe in, the gratitude. Whatever she said is completely applicable, and just follow, the law of attraction to stay mentally fit. Do the positive affirmations. Visualizations with a feel is what is very, very important. So that's about it.
That's wonderful takeaway for us. Okay, great.